Hello, future nurses. Welcome to your ultimate guide to mastering nervous system questions on the NCLEX. I know pharmacology can feel like learning a whole new language, but trust me, we're going to make it super simple. Think of the nervous system as your body's super smart computer. It controls everything from your breathing and heartbeat to your thoughts and movements. The medications we're about to discuss are like the IT department for that computer. They can speed things up, slow things down, or fix glitches. As a nurse, you are the one administering these powerful tools, so understanding them isn't just about passing a test, it's about keeping your patients safe every single day. You'll see them in the emergency room, on the surgical floor, in long-term care, and even in outpatient clinics. The NCLEX loves to test your knowledge of these medications because a small mistake can have a huge impact. Let's talk about the autonomic nervous system, or ANS. Think of it as your body's autopilot system. It makes your heart beat, digests your food, and makes you sweat when you're nervous. The ANS has two main teams, fight or flight, the sympathetic, and rest and digest, the parasympathetic. Cholinergic drugs are the rest and digest team. They boost acetylcholine. They slow the heart rate and improve digestion. For example, neostigmine is used for myasthenia gravis. Anticholinergic drugs block rest and digest. Imagine a stop sign for acetylcholine. Fight or flight effects take over. Your heart speeds up, your mouth gets dry, and your pupils get bigger. Here's a mnemonic: can't see, can't pee, can't spit, can't poop. As a nurse, be a detective. When you give a cholinergic like pyridostigmine, watch closely. Are their muscles getting stronger? Are they having trouble breathing? Safety is always a top priority. For more comprehensive NCLEX preparation, visit www.brispainternational.com. Now let's talk about seizures. Imagine the brain's electrical signals suddenly going haywire like a lightning storm inside your skull. That's a seizure. Anticonvulsants calm that storm down. Phenytoin is a commonly tested anticonvulsant. It slows electrical signals to prevent runaway activity. Phenytoin is tricky. It has a very narrow safe blood range, so we monitor blood levels carefully to avoid toxicity. A common side effect is gingival hyperplasia, swollen overgrown gums. A big teaching point: teach good oral hygiene, brushing, flossing, and regular dental visits. Phenytoin can also cause drowsiness and dizziness, so avoid driving. Rare but serious: Stevens-Johnson syndrome, a dangerous rash. Report any new rash to the doctor immediately. Benzodiazepines are the emergency first responders for seizures. Lorazepam is the most common. It boosts GABA, a calming brain chemical. It quickly stops an active seizure. It's used for status epilepticus, a seizure lasting more than 5 minutes, or multiple seizures without recovery between them. Lorazepam acts fast and can be life-saving. It's usually given IV for the quickest effect. Okay, let's move into the operating room. Anesthetic drugs make patients unconscious and free of pain during surgery. As a nurse in post-op recovery, watch the patient closely as they wake up. Monitor their breathing, heart rate, blood pressure, and level of consciousness. Now, opioids, powerful pain relievers, morphine, fentanyl, and hydromorphone are used for moderate to severe pain after surgery or for cancer pain. But they're CNS depressants. They slow things down. The biggest danger is respiratory depression. Breathing can become very slow and shallow, life-threatening. Always check breathing rate before and after giving an opioid. Nursing care balances pain relief with safety. Always have naloxone available for overdose. Naloxone can quickly reverse effects and save a life. Now, a rare but terrifying emergency: malignant hyperthermia. Parkinson's disease is a long-term condition that affects movement. Imagine your brain needs a chemical called dopamine to make smooth, controlled movements, like picking up a cup or walking. In Parkinson's disease, the brain cells that make dopamine start to die off. This causes a chemical imbalance, not enough dopamine, while acetylcholine stays normal. Tremors, shaking, rigidity, stiff muscles, bradykinesia, slow movements, trouble with balance. The gold standard is a combination of levodopa and carbidopa. Levodopa can be converted to dopamine in the brain. Carbidopa acts like a bodyguard for levodopa. It prevents levodopa from being broken down in the rest of the body, so more reaches the brain. This allows for a lower levodopa dose, which helps reduce side effects. Watch for dyskinesias, uncontrolled movements like twitching or writhing. Watch for orthostatic hypotension, a sudden drop in blood pressure when standing. Teach the patient to change position slowly. Sit on the edge of the bed for a minute before standing. Teach that medications manage symptoms but don't cure the disease. Effects can wear off between doses. Timing matters. High-protein meals can interfere with levodopa absorption. Space medication away from high-protein meals. Alzheimer's disease is the most common cause of dementia, a condition that slowly destroys memory and thinking skills. In the brain of a person with Alzheimer's, there's a shortage of the important chemical messenger acetylcholine. This chemical is vital for learning and memory. As the disease progresses, the brain cells that use acetylcholine are damaged, leading to confusion, memory loss, and changes in personality. The main class of drugs used for this are called cholinesterase inhibitors. A common example is donepezil. These drugs block the enzyme that normally breaks down acetylcholine, increasing the amount available in the brain. This can help improve memory, thinking, and the ability to perform daily activities for a period of time. It's important to teach families these drugs are not a cure. Benefits are often modest and temporary. Even a small improvement or a delay in symptoms getting worse can make a big difference in quality of life. Another drug you might see is memantine. It works differently. It helps protect brain cells from damage caused by too much glutamate. The goal is to maximize function and maintain quality of life for as long as possible, not to reverse the disease. Let's circle back to that scary anesthesia emergency we mentioned earlier, malignant hyperthermia or MH. This is a topic the NCLEX loves because it's a critical, time-sensitive situation where a nurse's quick thinking can save a life. MH is a genetic disorder, meaning people are born with the risk. It's triggered by certain inhaled anesthetic gases and succinylcholine. When a susceptible person is exposed, their body's metabolism goes into hyperdrive, calcium floods into the muscle cells, and muscles become extremely rigid and contract uncontrollably. This generates an incredible amount of heat, leading to a dangerously high fever. Recognizing the signs of MH is the most important first step. The earliest sign is often an unexplained rise in the end tidal carbon dioxide level. That's the CO2 they breathe out. Even when they are breathing faster, this is followed by a racing heart or tachycardia, muscle rigidity, especially in the jaw. The late and most famous sign is a soaring body temperature that can rise very quickly. If you are a nurse in the operating or recovery room and you see these signs, you must act immediately. This is not a wait-and-see situation. You need to alert the entire surgical team right away. Once MH is suspected, the team must spring into action. The first thing to do is stop the triggering anesthetic agent immediately. The patient will be given 100% oxygen to help with the high metabolic demand. The most important treatment, and the one you must know for the NCLEX, is the administration of dantrolene. Dantrolene is a muscle relaxant. It stops the release of calcium into muscle cells. This directly counteracts the core problem of MH, helping to stop the muscle rigidity and bring the metabolism back under control. It is the definitive antidote. As a nurse, your role in an MH crisis is crucial. You will be part of a team effort. Someone will be responsible for mixing the dantrolene. The powder needs reconstitution. You might be responsible for instituting cooling measures like ice packs to the armpits and groin, a cooling blanket, or cold IV fluids. You will also be monitoring vital signs, urine output, and lab values very closely. Know the signs, know the immediate interventions, and know dantrolene is the key treatment. This will prepare you for NCLEX and save lives. Visit www.brispainternational.com for comprehensive preparation.